Hello, welcome back. So today I want to talk about your thyroid health and how your thyroid health can actually affect your entire fertility. Now, when we talk about the thyroid is the little gland on your neck that looks like a butterfly that is directly below your Adam apple. Now, physically there's no connection between the thyroid and the reproductive system, but the thyroid plays a huge role in your reproductive organs and can even cause you infertility. Now, you need to understand that the thyroid produces two hormones that is responsible in metabolizing of every single cell in your body. So the thyroid is that powerful, and if something is wrong with the thyroid, cells and metabolism in your body can go wrong. Now, to understand this, when the thyroid is overactive, it's called hyperthyroidism. Now, when the thyroid is underactive, it's called hypothyroidism. Now, the question is, what is the major cause of thyroid disease? Now, thyroid is an autoimmune disease. It's where your body immune cells make antibodies that can activate or deactivate the thyroid gland. And in most cases, thyroid can arise due to inadequate iodine in your diet. The question is, how can something as little as the thyroid gland on your neck affect your overall fertility as a woman? Now, if you have a thyroid disease of any form, either hyperthyroidism or hypothyroidism. Now, hypothyroidism in women have been shown to hamper the release of eggs, which means that women who have hypothyroidism find it difficult to ovulate, and it can also impair their fertility. Now, women with hypothyroidism also have more risks of miscarriages and other pregnancy complications. They also experience lighter and irregular periods. Now, for men with hypothyroidism also experience erectile dysfunction, impaired libido, low sperm count. So it can lead to overall reduced fertility in men. So most times our problem is not even about the reproductive system, it's more about our thyroid system. Now, the question that might arise, how can I treat thyroid disease? Now, the treatment involves replacing the missing thyroid hormones or suppressing the overactive thyroid gland. Now, there is no diet that can totally treat your thyroid disease. So I suggest you seek medical attention and also be on the right medication. But there are some diets that can support the treatment of thyroid, which I'll also list down. So for hypothyroidism, that's on the active thyroid, some of the food that can enhance the ability of the thyroid to function in this area is number one is iodized salt. Then number two, you have to eat lots of seafood because seafood is rich in iodine. Number two, you can go with dairy. Dairy includes cheese and milk. Always choose organic dairy and also grass-fed meat that produces dairy. Then number three is seaweed. Seaweed is also rich in iodine. Also, pasture-raised cage-free eggs is also rich in high in iodine. Then other foods you can incorporate sea vegetables, Brazil nuts, and also maca, which is also can also help with the thyroid health. So for hyperthyroidism, that's the overactive thyroid, some of the food that can help you manage it is one, dairy. Dairy includes cheese and milk. I recommend raw dairy, organic dairy. Also turkey. Turkey is also very good. if you want to manage hyperthyroidism. And that food is also salmon. Salmon is a great source of vitamin D and also helps support bone health. Also berries, ginger, basil, rosemary, oregano, and also bone broth. Also cruciferous vegetables are also recommended for this case. But also do note that this doesn't replace the fact that you have to be on the proper medication. So some of the foods you need to avoid is gluten. Gluten can activate the autoimmune process that can lead to the development of thyroid disease. Also, in the food that you need to avoid is sugar, artificial dyes. Sugar and artificial dyes can also lead to autoimmunity. Also on the list is processed food, GMO food. All this kind of food can also lead to autoimmune diseases and also enable autoimmune diseases. So this is it for thyroidism and your fertility. So sometimes when we ask ourselves where is our infertility coming from, it can be from something as simple as the thyroid gland. So you need to know the source of your problem so you can best tackle it. Thank you.